Clients with borderline personality disorder often have other disorders, past trauma leading to PTSD, substance abuse disorders, eating disordered behaviors, anxiety and depression, all can go hand in hand with BPD.
So DBT addresses co-occurring disorders in two different ways. So DBT is organized into different stages. There's 4 stages of treatment. In the first stage of treatment, the goal is to teach the client skills so they can learn how to control their behaviors. So in that first stage, the client feels completely out of control in so many different ways. So they learn all those skills to try and get the behaviors that are really problematic for them under control. So that can include some of the symptoms that are found in these other disorders. So sometimes the behaviors they're trying to control are related to disordered eating, sometimes it's about using alcohol to regulate, and those are just some examples. The other way that DBT addresses co-occurring disorders is in that second stage of treatment. The second stage of treatment is all about emotional experiencing and for a client to be able to experience emotions in a healthy way. And so a lot of times that means we're addressing major depressive disorder symptoms, and that's also when we address PTSD symptoms. I enjoy working with clients that have borderline personality disorder because I find them to be some of the most compassionate people that I've ever met. There's a myth that people with BPD tend to be self-absorbed and only care about themselves, and I've actually found it to be very much the opposite. I find people with BPD to be, because they experience emotions in such big ways, they're extremely aware of other people's emotions as well. I'm driven to work with people with BPD because I want to help people get out of the misery that they're experiencing. And people with BPD are definitely miserable, and they're living in hell the way that they're currently living. And so I feel a drive to help people get out of that hell and live a life that's worth living.
I've been working with a client for a while, and this client at first had a really hard time just thinking about staying alive. Had constant suicide ideation and had other behaviors, that were just not very effective and very healthy. And so the client was able to complete treatment and then was able to eventually begin addressing the traumatic experiences that this client had. So, and the breakthrough is that we were able to address the trauma without no longer having thoughts of suicide. So this person was able to finally be free and be excited about life and living in a way where that person could heal from the trauma.
Well, my name is Sarah Darby, and I am an outpatient therapist, and I work with children and teens and adults who have difficulty kind of regulating their emotions.
So I'm Emily Dreyer. I'm a licensed professional counselor. I am the supervisor of clinical services. So I provide outpatient therapy to adults and adolescents. I supervise, and I'm also the point person of our crisis stabilization program.
My name is Rivka Hawaringa, and I'm an outpatient therapist here, and I run 3 different DBT skills groups.